Good afternoon.
It's not adjacent to anything at all, is
If I could ask all of you to stand and ask our Chief Operating Officer, Lori Lang, to give the invocation.
Thank you. Good afternoon. Today we give thanks for the opportunity to care for our community. We are ever mindful of this great responsibility to provide healing and hope to those we serve. We ask that our efforts be guided by wisdom, compassion, and understanding. We join the hospital board in seeking this insight to make decisions that will lead to a better and healthier community. May all that is done here today be for the good of those who have placed their trust in the Sarasota Memorial Healthcare System's leadership. Thank you.
Join me in the Pledge of Allegiance.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, good morning. Good morning. There you go. Good afternoon. I call this meeting to order. And before we get started, just let me read the public comment statement. Any citizen desiring to address the hospital board should turn the speaker card to the board secretary. If the citizen's comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, requests for proposals, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Thank you. All righty, orders of the day. We have any?
I'll make the motion that I move that we approve the orders of the day.
All righty, well, thank you.
Tell the secretary to wake up over there.
There we go, second. All righty, all those in favor of the motion on the floor, please signify by saying yes.
Yes.
Opposed, no. All righty. Next, if I can get a motion to approve the minutes of the March 18th, 2018 meeting.
Motion.
Second.
All righty. Any corrections, deletions? If not, all those in favor signify by saying yes.
Yes.
Opposed, no. All righty, thank you. We do not have any board reports, so with that, Dr. Seaman, if you'll introduce Dr. Stolarski. And
So Dr. Stolarski was not able to make it due to some issues in the surgery
Okay.
area.
all righty, well,
He's replacing more hips.
yeah, well, as a person who's 15 years and going with a hip replacement, I want him to keep on moving then. All right, with that in mind, I'll turn it over to our CEO, David, and you have some awards today, huh?
I do. Isn't that a great thing?
It is a great thing.
So I am proud to be able to introduce you to our Excel Award winner for April 2019, Ryan Shepler. Ryan, come on up. Congratulations. Thank you. Come stand by me. I'm going to say some nice things again about you. So Ryan Shepler is our April Excel Award winner. He's a licensed physical therapist assistant and has been with Sarasota Memorial since 2018. Ryan's coworkers describe him as a great employee whose positive attitude rubs off on everyone around him. He's always in a good mood with a smile on his face. There you go. The common theme in Ryan's nomination is how he goes the extra mile for his patients. Ryan takes time to encourage and helps patients. He makes them feel strong and capable. We've seen him change a trauma patient's whole attitude by taking time to bring him outside for fresh air. He's an effective communicator with patients, staff, and doctors. Even his notes are clearly detailed, which is a tremendous help for case managers into discharge planning. His coworkers say they want Ryan to know his hard work is appreciated and doesn't go unnoticed. Ryan, congratulations. Well deserved.
Congratulations. The Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the vision, mission, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes you, Ryan, with the Excel Award for the month of April 2019. Thank you for your continued dedication to excellence. It's signed by David Garner, President and CEO, and Joe DiVirgilio, the board chair. Congratulations.
Thank you. Ryan, you can keep it this time and come up and say a couple words.
I just want to say it's a real honor because I work with so many great people, and thank you very much.
You're very welcome. David, have a hero award today.
I do have a hero amongst us. So I'd like to introduce you to our Hero Award for April 2019, Catherine, or Katie Montgomery. Catherine? How are you?
Good, how are you?
Good to see you. You doing well?
Yes.
Okay. Here, come stand by me. All right. So, Katie Montgomery is our Hero Award recipient for the month. She's a licensed practical nurse at our Heritage Harbor Urgent Care Center. So here's her story. A man entered Heritage Harbor Urgent Care asking for help with his mother. He was bringing her to the ER when he said she passed out in a car. He wasn't sure what to do next. Katie went to the car and found the woman unresponsive, with shallow breathing and dilated pupils. She instructed the son to dial 911. Another nurse requested STAT EMS service. The son reported no known diabetes or heart disease, but that his mother had asthma and COPD and had been without her nebulizer treatment for 2 weeks. He noticed her shortness of breath and thought she needed emergency care. Within 2 minutes, the woman had no pulse, so Katie removed her from the car, laid her flat on the ground, and began CPR. Simultaneously, she asked one of the urgent care doctors to come outside and assist. After 6 minutes of CPR, EMS arrived and the patient was stabilized for hospital transport. Thank you for the quick thoughts. We appreciate it.
Thank you so much for what you did. Hero Hall of Fame. The Hospital Board Administration staff of Sarasota Memorial Healthcare System hereby induct you, Katie, to the Team SMH Hero Hall of Fame for actions that capture the essence of a true hero, including courage, to have persistency in the face of fear, passion to always do the right thing, integrity to have a strong moral compass, and concern to have concern for the well-being of others. It's signed by David Verender, our President and CEO, and Joe DiVirgilio, the Chair of the Board. Congratulations, Katie.
Thank you.
They love it.
I just want to say that I appreciate this very much, and this is why we're here for the community. You never know when they're going to need you, so I'm just blessed to be in the right place at the right time.
Well, thank you for everything you did. Congratulations. It always amazes me, the heroes. I mean, every employee here is a hero every day to each of our patients, but to have somebody really go above and beyond that it's a pretty spectacular thing, and we appreciate it. All right, moving on. Dr. Seaman, any report from the medical staff? I know we have a number of motions, so I
Yes,
caught you
several
in the middle of whether you're going to
But-
do them or not. No.
No.
We do have a number of motions, though, coming out of medical staff.
And I would be glad to present those motions. And the first one is item approval of TEE privileges. I propose a motion. I move approval of the transesophageal echocardiography privileging criteria as recommended by the Medical Executive Committee.
Do we have a second?
Second.
Any questions? All those in favor of the motion, please signify by saying yes.
Yes.
Yes. Opposed, no.
I have another one. and I do propose the motion. I move approval of the hospice and palliative medicine generalist core privileges as recommended by the Medical Executive Committee.
Second.
I have a second. Any comment? All those in favor signify by saying yes.
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 Opposed, no.
And the
Third.
last one, proposed motion, I move approval of psychiatric department rules as adopted by the department and approved by the Medical Executive Committee.
We have a second.
Second.
Any discussion? All those in favor signify by saying yes.
Yes.
Opposed, no. Alrighty, anything further?
No.
All right, thank you.
No.
All right, move on to the foundation, Mason Ayers.
Thank you, Mr. Chair.
Golf is in the air, huh?
Golf is in the air.
There you go.
Before I jump over to golf, I just wanted to give a quick update on the Women in Medicine program that was held on March 29th at Michael's on East. We had a full house, and it was a wonderful luncheon and quite successful. We ended up raising over $170,000.
Fantastic, well done.
And those proceeds are for the SMH Internal Medicine Residency Program. Mouthful there. So it was a wonderful, wonderful day, and just wanted to give you an update on that, and then I'll move quickly over to golf. We still are making plans for May 3rd, Friday, at Laurel Oak Country Club. We're expecting a big crowd, and the beneficiary for the golf tournament is the SMH Physician Endowment Fund, which is used to provide educational resources to the SMH staff. So I hope all of you can join us Friday, May 3rd for the golf tournament. That concludes my report.
Fantastic, well, that's great news, thank you. All right, Secretary report, Greg Carter.
Thank you, Mr. Chair. Next month, in May, on the 20th, will be our board meeting. We have 9 o'clock Mission and Planning Committee meeting. That will be a 2-hour meeting lasting till 11. And from 11 to noon, we have Finance Committee. From noon to 12:30, our closed session of the hospital board meeting. From 12:30 to 2, our board lunch and financial review. And from 2 to 4 will be the actual board meeting. And one other real quick note, a reminder that tomorrow at 10 is our oncology, Phase 2 oncology groundbreaking. And that concludes my report.
All right, thank you, Greg. All right, move over to our treasurer's report, Sharon Wessler, DePeters, our treasurer.
Yes, and I have a proposed motion. I move approval of the bad debts and charity care for the month ended March 31st, 2019, in the amount of $27,315,000.
Second.
Motion is second, any discussion? All those in favor of the motion signify by saying yes.
Yes.
Yes, opposed, no? All righty, thank you, anything
That
further?
concludes my report, Mr. Chairman.
All righty, excellent. All right, with that, we'll move over to financial highlights and our CFO, Bill Wojcik. Bill?
Thank you, Mr. Chairman. I have the financial highlights for March, and this represents 6 months of activity for the fiscal year-to-date numbers. Starting with operating revenue, for March, $86,679,000 compared to a budget of $84,913,000. Through 6 months, $479,584,000 compared to a budget of $455,124,000. Looking at total expenses for the system, for March, $79,100,000 compared to a budget of $79,829,000. Fiscal year to date, $444,162,000 compared to a budget of $439,086,000. Operating income in the rating agency format for the system, for March, $11,591,000, comparing favorably to the budget of $9,010,000. We had an operating margin of 12.7% for March compared to the budget of 10% on operating margin. Through 6 months in our fiscal year, operating income of $59,674,000, which represents an operating margin of 11.7%, compared to the budget of $39,591,000, budgeted operating margin of 8.2%. Looking at the statistics for the hospital, the average daily census, and this is through 6 months of activity, average daily occupancy of 584 patients compared to the budget of 562. The average acute length of stay, 4.28 days so far this year, compared to last year at this time, 4.47. In admissions, we have 21,472 through 6 months, compared to a budget of 19,051. Surgery cases in the hospital, again through 6 months, 12,552, compared to the budget of 12,322. And so far this fiscal year, we have 1,889 births, compared to the budget of 1,762. Continuous statistics, hospitals outpatient registrations, fiscal year to date, 241,843, compared to the budget of 249,265. Our emergency care center registrations for the two ECCs combined, 65,102, compared to a budget of 65,356. And through 6 months, our case mix index for all patients, 1.84, and for Medicare patients, 1.91. Mr. Chairman, that concludes my report.
All right, thank you. Any questions for Bill? All righty, thank you very much. All right, committee reports. The only committee we've had this morning was the Quality Committee. Sharon?
Yes, I do have proposals.
No.
We already did those.
We
You don't-
do them?
Yep.
Because we did it in the confidential session,
Okay.
so just to remind the public
All
that we
right.
do meet in confidential session.
We do meet in confidential sessions, and I already gave my proposals, so I'm sorry to have brought it up again, but it's been taken care of. Thank you anyway.
All right, thank you. David, President's Report, you're up. I know you're not used to it this early in the
I
meeting.
know,
but,
I was, had to rush up here real quick. No, you did not. Before I get going, I had somebody ask me about my tie today. And I said, "What are you wearing, a Florida tie?" And I said, "Absolutely not. It's an Auburn Tiger tie, signifying that they won, they got into the Final Four." So there you go. There's a shout out. All right, so starting on our report card today, our fiscal year to date through March 2019. This actually comes out to our first 6 months of our fiscal year. We'll start in the service category with looking at system patient experience, and our goal there is likelihood of recommending number of services in the area greater than or equal to the 75th percentile. We have a goal of having 8 out of 10 of our areas being in the greater than or 75th percentile. I'm happy to report that it's the highest number that I ever remember reporting, that we're at 9 out of 10. So a lot of hard work by a lot of people here. We'll show you the detail here in the next slide. But thank you to all of our staff for going above and beyond in this extraordinarily busy season to make our visitors feel welcome. In the people section, we have our turnover of part-time and full-time staff, those hired within the last 12 months, of being 24% turnover or less. Happy to report we are exceeding that at 22.07%. So we are hiring well and retaining. In the quality area, we have our goals being our infection prevention, which is our combined overall standardized infection rate of being less than 0.93. Just to remind everyone, the national average or expected is 1.0. We are at a all-time low number at 0.69. I've never seen it that low. So once again, thank you to our medical staff for really going above and beyond. In the finance section, we've already heard our finances from our CFO, Bill Wolgen. We have our goal is having our organizational finance or our operating margin be at our budget, 6.5% or better. We are currently tracking to be 8.4% operating margin. And in the growth section, we have two goals. One is our inpatient admissions and observation outpatients being at 46,070 for the year. We're currently tracking to exceed that at 50,110. And our outpatient registrations, we have a goal of being at 894,000. We are tracking a little bit lower than that goal at 889,000. So looking a little bit more detailed into our patient experience report card, you can see the 10 different areas that we measure on our likelihood of recommending. You can see in the next column over what our score is, what the national median score is, and then finally what the 75th percentile score is. So we are hitting 9 out of 10 of those, and the one that we're not hitting, we're within 1 point of national median and within just a couple points of 75th percentile. So really thank you to all of our staff for these fine results. Earlier this month, it was kind of amazing. I didn't know that Newsweek put out hospital ranking lists, and it was actually one of our community board members who forwarded it to me, because that's how we found out about it. But Newsweek ranked Sarasota Memorial as one of the world's best hospitals in a global ranking, and so anybody who wants to rank us as a world's best, we're all in. So we'll report that. SMH was one of 6 hospitals in Florida to make the inaugural list, which spotlights over 1,000 hospitals in 11 different countries. And then hospitals were selected based on medical performance indicators that include low mortality, complication, and readmission rates, as well as recommendations from medical professionals and patient survey results. So congratulations to our board, to the community, and to all of our staff. We also, this past month, had our groundbreaking for our Sarasota Memorial Venice Hospital. Sarasota Memorial, City of Venice, our community, business and neighborhood leaders broke ground earlier this month on the new Sarasota Memorial Hospital Venice, marking the start of the largest expansion in our hospitals, our healthcare system's 94-year history. The hospital set to open in fall 2021, initially with 110 private patient suites. So you can see a picture of Sharon there. Sharon, are you here? Yep, there you are. You can see a picture of Sharon there right before she got up and told us all about it. And I want to just also thank the board who are really all there. We appreciate your support in this. SMH also this past month marked our physician residency match day. So each year in March, graduating medical school students across the nation learn where they'll complete their residencies on match day. This year, Sarasota Memorial and Florida State University College of Medicine welcomed the third cohort of internal medicine residents who will start July 1st. The 3-year program will have a total of 39 residents as of this July, so it's our full complement now. SMH and FSU will also welcome our very first cohort of 9 emergency medicine residents starting this July. So it'll be the first time we've welcomed our emergency medicine residents to this campus. We'll have 9 each year for the next 3 years and build up to that program too. SMH recognizes the 29th Daisy Award winner. So congratulations go out to Daisy Award winner Lindsay Rimple, who's you see all of her initials there. She's BSN, RNC, NIC, CBC. I can't tell you what all those mean, but I know they're really important. An invaluable asset to Sarasota Memorial's NICU team. Lindsay is SMH's 29th Daisy Award recipient. An international honor, the Daisy Award recognizes nurses who make an extraordinary difference in the lives of patients and families. Our Chief Nursing Officer, Connie Anderson, above and to the right, and also sitting here, presented her with the prestigious award along with the clinical manager, Heather Graber. So congratulations. We got this opportunity to celebrate our excellent medical staff. So in March, Sarasota Memorial paid tribute to our amazing physicians during the National Doctors Day, running a thank you ad in the Sarasota Herald Tribune and celebrating physicians throughout the hospital. I know a number of our board members took time out of their day to come up and thank physicians in the lounge and at the entrances. And I can tell you it means a big difference, and they very much appreciate that. Staff also gets a close look at a robot to help diagnose cancer. So our thoracic surgeon, one of our thoracic surgeons, Dr. Paul Chomiak, and our interventional pulmonologist, our own Dr. Joseph Seaman, demonstrate the new Monarch robot, which helps diagnose lung cancer at earlier stages and more treatable stages, as well at a recent open house. SMH is just one of 10 hospitals in the nation to have chosen to deploy the platform. So, Dr. Seaman, we do appreciate your leadership on that. I am not 100% sure what you and Dr. Chomiak are doing in that picture, but I'm sure it was all scientific and very necessary, right? Absolutely. Breaking ground on our new oncology center. We get to do that tomorrow at 10 o'clock on the main campus. I'd like to make sure we invite all of our staff, all of our board, all the community to come out and help celebrate the groundbreaking of our new cancer center, which is scheduled to open in late 2021. We are currently have model rooms set up in our Med Arts building where we have been we've done this every time we've built a new facility, where we have looked and see how placement of furniture works, how doors work, how everything works. We have our clinical staff go in and take a look at it, tell us what works, what doesn't work, and really we use all that feedback, and sometimes we scrap the whole original plan and go with a second plan, or third or fourth, and until we get it right. So it is a practice that we have been used to since we did the Courtyard Tower and possibly earlier in that. But it's one that's really paid off for the satisfaction of our patients and the function of the hospital. Our SMH oncology nurses provide cancer information at a community expo. Oncology nurse navigators from Sarasota Memorial provided educational information on cancer prevention at the March 9th Newtown Health and Education Expo at Janie's Garden Clubhouse. Approximately 100 community members attended the expo, which featured information from a wide variety of community resources. So we appreciate our nurses taking their time to go do that. We have a couple different areas at a hospital that we are recognizing during the month of March and first part of April. So we have our Registered Dietitian Nutritionist Day, March 13th. We had our Health Information Professionals Week of March 24th through the 30th, and our Patient Registration Week, March 31st through April 6th. So we had a chance to celebrate all these individuals that make a huge contribution to our organization. And with that, that is my report, Mr. Chairman. I'd be glad to answer any questions.
Anybody have any questions for David? All right, you get off easy today.
Thank you, sir.
All right, you're welcome. We have anything on the consent agenda? Not a thing, huh? Any public comments? No, sir. No public comments. Back to you, legal matters?
I have nothing.
All righty. Well, if we have nothing else for this group, we stand adjourned. Congratulations and thank you. We'll see you next month.